If you think the knee gets injured for no reason, you are mistaken. It is often related to overall body mechanics. For example, if you're wearing old, worn-out running shoes, you may end up having knee and foot pains. Tight buttocks or tight muscles around the sacrum pass tension down to calf muscles, causing an excessive stress on Achilles tendon. The same applies to plantar fasciitis. Knee pain is often linked to wear and tear in the lumbar region of the low back. To get the best out of the FlexBeam, apply it to the area which hurts the most. In case of an ongoing issue, at the sacrum or lumbar part of the low back. FlexBeam can assist you in your recovery by stimulating blood flow, easing tight muscles, and removing the compression. Regular application will help in natural healing. Choose preset 3 for any issues with your knees and preset 2 or occasionally 3 for your feet. Always start with placing the FlexBeam on the area where you feel the issue. If your issue involves one knee, you can start by applying the FlexBeam on the front and back of that knee. With feet, apply it to the top and bottom. In case of an ongoing knee issue, add an extra position over the sacrum. In case of an ongoing feet issues, place the FlexBeam behind both knees and the sacrum too. If the issue is recent, use the FlexBeam for 20 to 30 minutes daily with the weekend off, and if the issue is ongoing, use the FlexBeam 30 minutes every other day for 3 to 4 weeks, followed by 1 or 2 weeks off. The effect is cumulative, but you can stop when you're happy with the result.